Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture is psychiatric emergencies. So there is a range of variables that are presented in the emergency department and that are related to the psychiatry department, and as well as they're shifted on to the PICUs, that is basically the psychiatric intensive care units. They're basically specialize in the psychiatric ailments of the individuals. So today's lecture basically comprises of the first section, which basically revolves around the behavioral disturbances, and there is a range of variables even to this single terminology, which is known as the behavioral disturbances. First of all, we'll be defining these disturbances as obviously there is variation in the behavior of any individual, even if he's considered to be normal. So we'll be discussing what is basically considered to be an abnormal behavior and how do we basically go on to assess these patients, and then finally obviously the management of these patients. The risk factors, the causative factors will be discussed along with them. That basically range from the environmental conditions of the individual to his or her personality traits. And then finally, we'll be discussing the presentation of these acute behavioral disorders or these behavioral problems. How do they present to the emergency departments is again very important. In the very second section, we'll be discussing the antipsychotics. So there are a lot of side effects that are related to these antipsychotic medications that are a part and parcel of the management of the psychiatric ailments in a lot of individuals. For example, schizophrenia, psychosis, mood affective disorders. So we'll be discussing what is the range of side effects that can be presented as the psychiatric emergencies even. We'll be discussing the management of these withdrawal symptoms or even the side effects of these antipsychotics over here. And along with that, we'll be discussing the non-medical interventions that basically comprises of the counseling sessions with the patient, giving him or her the insight towards his or her problem. So we'll be discussing the rapid tranquilization technique if that is needed in that particular case. It's basically the tranquilization and then the rapid tranquilization. What are the kind of drugs? What are the different group of drugs that are allocated for such a purpose? In the third section, we'll be discussing delirium tremens, which is basically the withdrawal symptoms of the alcohol. So we'll be discussing this condition in detail over here, the clinical manifestations of delirium tremens, and then finally the risk factors that are related to such a condition will be discussed over here, along with the management of such cases. That basically starts off with the history taking and then the assessment of the patient, whether the symptoms are of the mild, moderate, or of the severe variety, and then finally deciding what treatment modalities we need for that particular patient. In the fourth section, we'll be discussing the lithium toxicity and along with that, acute dystonias. So lithium toxicity, lithium is again a mood stabilizing drug, which is very commonly given in the mood affective disorder or in the bipolar disorders, and it has its own side effects. So we'll be discussing them over here. Along with that, we'll be discussing the acute dystonias and the multiple levels of actions of this lithium as well over here in this fourth section. In the very final section, we'll be discussing a very rare psychiatric emergency, basically, which is known as the neuroleptic malignant syndrome. Another variant from which we have to distinguish this neuroleptic malignant syndrome is the serotonin syndrome, which was basically more or less of the same presentation, but we should know how to distinguish between these two conditions because the treatments are different in both of these conditions. The medications causing these neuroleptic malignant syndrome, working as a clinician, one should be aware of this fact. And then the signs of the neuroleptic malignant syndrome. Along with that, we'll be discussing the management, the treatment, the differential diagnosis that is related to the neuroleptic malignant syndrome. So I hope you want to learn more about the psychiatric emergencies. So do watch the other sections to this lecture as well.